tonight's program. Thanks to all of you for being here in spite of the weather and in spite of the fact that tonight is the first Monday night football extravaganza of this NFL season. So I'm glad we were more important to you than the New England Patriots, or the Buffalo Bills, as the case might be. I've seen a lot of familiar faces in this crowd, and pleased you're here. But for those who don't know me, my name is Jack Gray, and for lack of a better definition, a better title, I'm the Public Affairs Officer with Hunt Regional Healthcare. And of course, Hunt Regional Healthcare is one of your hosts for this program this evening. Among my official duties tonight is to welcome you to House Calls, a town hall meeting that has been called by the Texas Medical Association and your doctors. The purpose of this meeting is to provide you with an opportunity to share your opinions on the topic of national health care reform, in the belief that even regular Americans like you and me have something of value to contribute to this issue. And really, how much more timely could this be? Last week, President Obama laid out his plans for health care reform on network television. Many agree with his health care agenda, and many do not. Those here tonight may disagree with one another, and that's okay, because that's what democracy is all about, giving everyone an opportunity to express their views. While disagreement with one another is perfectly acceptable, we do have some house rules in place that require any disagreements that are expressed to be done in a spirit of harmony and goodwill and in a civil tone. This is not a debate. I would like to acknowledge other local hosts for this event. The Greenville Chamber of Commerce, and I saw Sally Bird out there earlier. Sally, thank you and the Chamber for your efforts in supporting this. Also, the Hunt County Alliance for Economic Development. I saw Mary Sue Cole, who I guess, Mary Sue, I don't have a title, but you're kind of the executive director of that organization, and we also appreciate your support. We want to thank those organizations for their leadership and for recognizing the importance of the issues and supporting this town hall meeting. Some other folks I would like to acknowledge who are here, and I'm probably going to overlook somebody. There's always a danger of doing that. I would like to call your attention to State Representative Dan Flynn. Dan, if you would stand and say hi to folks. Other acknowledgments from Hunt Regional Healthcare, where a number of people here, most of our administrative team, Richard Carter, CEO of Hunt Regional Healthcare, Mike Kleppen, Administrator of Hospitals. I think I saw Debbie Clack out there, who's the Chief Nursing Officer, and John Heatherly, who is also an administrator for the hospital district. Who else? John Horn, County Judge. John, thank you for being here. Well, and last in my list, but certainly not least, so Harold Payne, thank you for your support. As everybody here knows, healthcare and healthcare reform are, it seems like, constantly in the news today. It doesn't just seem like it, it's really a fact. We hear that millions do not have access to healthcare. We hear that healthcare is too expensive. We hear lots of things that illustrate why this is such an important issue. While there may be issues revolving healthcare in 2009, I wanted to share with you for a moment what healthcare was like exactly 100 years ago in 1909. You know that you're aging when you recall that your dad was born in 1908. So that's the situation I'm in. In 1909, the average life expectancy was 47 years. I'm sure these doctors can correct me on this if I'm wrong. I think today it's in the mid-70s for men and the early 80s for women. In 1909, more than 95% of births took place in the home. There weren't any state-of-the-art birthing centers like we have at Hunt Regional Medical Center. In 2009, and forgive me doctors, 90% of all doctors had no college education. The so-called medical schools of that era were regularly condemned by the press and by the government. And in 1909, the three leading causes of death were pneumonia and influenza, tuberculosis, and diarrhea, diseases that today are usually treatable with modern medicines. I also noticed that in 1909, most women only washed their hair once a month, which couldn't have been too healthy, and they used borax and egg yolks for shampoo. Just a little aside there that I thought you might find it. Times have changed, and although healthcare issues are still at the forefront, substantial progress has been made during these past 100 years. Tonight we have a group of, and this is the reason I'm actually up here, I'm here to be a transition, to introduce people and to get out of the way. Tonight we have a group of very distinguished panelists, medical practitioners, elected officials, TMA executive staff, and they want to hear from you. I'm certain that they also would be willing to try to respond to questions you might have, but they would like for you to wait to pose those questions until the end of the meeting, and they'll be happy to stay and respond simply because they have a number of questions that they'd like you to respond to, and then they'll take your questions in turn as we get near the end. It's my privilege to introduce your panel, and I'll introduce them in the general order of their expected appearance, some at the rostrum and some not necessarily at the rostrum. Opening remarks will be provided by Dr. Michael Sills, MD, a cardiologist and president of Cardiology Consultants of Texas. Dr. Sills has been attending cardiologist at Baylor University Medical Center, and we are fortunate to have him in that capacity at Hunt Regional Medical Center as well. He has served as the Assistant Chief of Cardiology and the Medical Director of the Cardiac Non-Invasive Laboratory at Baylor. He's also been Chair of Cardiology at Hunt Regional Medical Center. And there are lots of other credentials, so I won't take time to share with you tonight, but you can probably see why, with those credentials, why I picked him as my cardiologist. Following Dr. Sills and serving as our program facilitator will be Dr. Bon Allen, MD, a general surgeon who has been in practice in Arlington since 1971. Among the interesting facts about Dr. Allen is his distinguished military career. During the Vietnam War, he ran a burn unit at the 106th General Hospital in Yokohama, Japan, where he consulted on the treatment and evacuation of burned patients for the Far East Command. Dr. Allen is a past president of the Medical Societies of Arlington and Fort Worth, in addition to his service as a past president of the Texas Medical Association, the organizer for this program. Dan Finch. Dan, where are you out there? Dan Finch is in the rear. Dan will be here to share some thoughts with you a little later in the program. He is the Director of Legislative Affairs for a job he's held since 2006. And as I said, he'll be providing you with a summary of health system reform. He previously served as Associate Director of Public Affairs for the Harris County Medical Society for 24 years. Today, he represents the interests of more than 43,000 Texas physicians, residents, and medical students who are members of the nation's largest medical association. Finally, last but certainly not least, State Senator Bob Duell, MD, representing Hunt County in this area in the Texas Senate. He has maintained a family practice in Greenville with primary care associates for the past 23 years. During his time in the legislature, Dr. Duell has passed dozens of pieces of legislation, including legislation related to health care, and was recognized in 2007 as one of Texas' 10 best legislators. He was again recognized by Texas Monthly magazine for his work during the recent 81st Texas legislature. Dr. Duell will provide views on this issue throughout the program from his perspective as both a physician and an elected member of the Texas legislature. Ladies and gentlemen, please help me welcome our distinguished panel as I turn the podium over to Dr. Michael Sills.
Good evening. they'd asked me to kind of open this up with some of the perspective of a local physician. And I think it's important that physicians are involved in both the discussion and this process, because I think that it is our voice as well as the voice of the patients and everybody out here that will help make this process and the decisions that we're going to make going forward more meaningful. Because I think if we leave the patients, if we leave the doctors out of this process, what we're going to be left with is people who don't know us, don't know what we do very well, making decisions that probably aren't exactly what we want them to be. I think there's a lot of misconceptions. I think we've all listened to the debate so far. I think there's a lot of things that have been said to scare people. I think a lot of people are scared because we don't really understand what's going on, and I think a lot of things that have been said have been incorrect. I think it is a mistake to think that our healthcare system is not the best in the world. You'll read stuff that says we're the 37th in the world. If you actually take out factors such as the cost of healthcare insurance in this country to the individuals, and the fact that it isn't universally available, we're routinely and uniformly the best in the world. And this is something we all know. Having said that, right now we have a lot of conflicts in that. We know that health insurance companies do risk management and exclude a lot of people who like insurance, both for pre-existing conditions as well as a function of cost. Many of us have enormous deductibles, which a lot of people, frankly, right now can't afford. We know that the government has made Medicare and Medicaid often onerous by ratcheting down payments to physicians, and often at the same time not really looking at what is really appropriate care. You hear the terms waste, fraud, and abuse. Most docs resent that very much. We're not very wasteful. What we try to do is take really good care of as many people as we can. And at the same time, many of these programs, including Medicare, are going to run out of money. As I'm in my mid-50s, I worry that 10 years from now, when I become eligible for Medicare, there won't be enough money for me to be cared for. That's a concern. We're going to have a national dialogue about how we are going to manage the costs of Medicare. And at the same time, take good care of all of us and leave enough money so that not only me, but my children will have that kind of health care available to them. I think we have to bear all of this in the same context that we're running short doctors. Right now, the average indebtedness of a medical student coming out of medical school is about $170,000. And if we don't start dealing with how we're going to reimburse these young people in a way that will keep them going to medical school and keep them in practice, we're not going to have enough doctors to take care of any of us. And that's something that we have to look at. Because if we don't have enough doctors, if we don't preserve the patient and doctor relationship, as I said before, we are going to give those decisions over to people who don't understand what medicine is all about, who don't understand what patients need. And we're going to end up with something that isn't what any of us really want. Now, I agree that there isn't enough money, but we have got to be able to have, as Jack said, a civil, national discussion about how we are going to take good care of as many people as we can with less money. And I will tell you that, again, if we don't put the needs of the patients first, we will all end up with something that will not be what any of us want. And I'll stop there because we're running a little bit behind on time. I'll be happy to take any questions later on.
Well, first of all, on behalf of the TMA, I certainly want to thank Hunt County and all of the sponsors that helped put this house call together. We want to thank certainly Mr. Gray for paving the way to get this facilitated and done. And we want to thank Dr. Seals and Dr. Dool for being here and contributing to the program. First of all, we're going to kind of set some ground rules of how we're going to do this. And before we actually get started, let me just tell you that the Texas Medical Association and the majority of doctors in this state have neither endorsed nor rejected any specific plan, because at this point it's a moving target. We don't know what the final plan will be. And so as a consequence, the Texas Medical Association got together a task force that included a huge number of physicians and came up with certain principles that we feel protect the rights of our patients. And then we measure any health care reform bill against those principles and decide whether we support certain principles and whether we reject certain principles. So at this point, since there is no concrete bill, we're neither for nor against any specific bill. And so we will judge that as we go down the road, and Mr. Finch, a little bit later, is going to take you through the legislative process of where we are and where we might wind up. I will say that among those principles, the most important principle is that of the sanctity of the patient-physician relationship that Dr. Seals referred to. That is probably the most intimate, private relationship that two people can have, because patients will tell their physicians things that they will not tell their parents, their spouse, nor their children. And we must never violate the trust of that sacred patient-physician relationship, because if that trust is ever violated, then we all lose. So first and foremost, we must protect the sanctity of the patient-physician relationship. The other things that we think are very important that we want you to think about tonight is access to care. We need to provide access to all Americans so that they have a family home, a physician, and health care when they need it. And I'm not talking just about insurance, because insurance does not necessarily equal access. We know in the government-sponsored programs of Medicare, Medicaid, even TRICARE, that we have people who have insurance, but they don't have access to care because of the arcane payment system. We think choice is very important. Patients tell us all the time they want the choice of their doctor, they want the choice of their hospital, and they want the choice of the plan. Doctors likewise tell us they want choice. They want to be able to decide if they're going to participate in any specific plan or not participate. And most of all, they want to be able to participate with their patients. And the last thing that we think is important is that no matter what happens, no matter what the final plan is that comes out, we think patients and physicians should have a chance to privately contract outside of whatever plan there is, so that no one is locked into a single system that they cannot get out of. So those are just sort of some of the touch points that we want to kind of have you tell us about. But the reason we're here is to find out what your questions and concerns are. As was pointed out by Jack, this is not a debate. There are no right answers, there are no wrong answers, there are no right questions, there are no wrong questions. We are here to get feedback from our patients so that we may be better advocates for you in this healthcare debate. And we're going to start out by asking you a series of questions. These are questions that are designed to have you tell us what you think about healthcare reform. Hopefully, we don't want to know about the emergency room at the hospital you're unhappy with. We don't want you to name any specific hospital or doctors, because we're more interested in finding about healthcare reform than we are about specific instances. So we'll ask you the first two questions, and then Mr. Finch is going to give us a overview of the legislative process and where we're going and where he thinks we might wind up, and then we'll save the most time for the last question. try to be mindful of your neighbors. We want to try and limit your questions and comments to about a minute so that we'll have time for everybody to have their chance to speak. But most importantly, even if you ask a question, write it down on the cards that are at your seats, because we're going to collect those cards at the end of the meeting, and we keep those and catalog them so we know what your concerns are and we can express your concerns when we deal with this issue. So if you don't get a chance to ask a question, write it on the card, leave it in the chair, and at the end of the program, we will come around and collect the cards from the chairs. You don't have to try and give them to us, just leave them in place and we will collect them. So that's kind of the ground rules of where we're going. So we're going to devote about 10 minutes to this first question. We'd like for you to focus on the question and tell us what you value the most about today's healthcare system. The single thing you value the most, not necessarily what you like or don't like the most, but the thing that you value the most. Mr. Finch is going to be operating one microphone, and the other microphone will be handled in the back here. So, Susan. All right, I couldn't get my name on Susan there, but Susan will have the other microphone. So just raise your hand and they'll come to you. Wait until you get the microphone so we can all hear. So the first question is, what do you value most about today's healthcare system? We have a question right here and here.
I feel strongly that the health care we have today is inexpensive, and anybody that can't afford it should have it, period.
Okay. All right.
What I value about today's health care is my ability to choose the doctor that I want to see without the government interfering with that.
Very good. Choice is what we're most concerned about. That's very good. Right here in front.
I agree, one qualification on that is being able to keep the insurance.
I can't hear you. We can't hear.
We can't hear.
The insurance company out of it. Okay, well that certainly is where a lot of the debate is headed today, is of what the position of insurance companies are. They're the ones who collect the premiums, and that's a real concern of some people. All right, do we have any other comments or questions with regard to what you value the most about today's healthcare system? Right back.
I value the quality of our health care in the United States. We have the finest quality.
All right, she values the quality. We have a question in the back here.
I like the fact that if you don't like your present doctor, you can choose another one.
Choice is very important. We agree with you, and that certainly is one of the things that I think the American people value the most, is their ability to have choice. Another one?
Being able to see a doctor 24/7 when I think I need to see one and not want a bureaucrat.
Access to care. That's certainly one of the things that we're interested in, and that is important. All right, are there any other questions on what you value the most about today's healthcare system?
My wife is a three-time cancer.
I can't hear him.
Turn
Turn the mic on.
Technology is great. Technology is great. She's a three-time cancer survivor. She has had a stem cell transplant and has been 7 years since that cancer-free. So the technology that we have that are saving our lives and extending our lives is phenomenal.
Okay, well, that's a great thing to value, is technology, because America leads the world in technology. There are still seats down front. If anybody in the back who's standing would like to come down, we still have plenty of seats up here. Okay, are there any other comments or questions back here in the back?
I value the fact that the privacy between you and your doctor is just between you and your doctor and not the entire United States government.
That gets back to that patient-physician relationship. When you're in the examining room, only two people should be in there to make the decisions, the patient and the physician. There's no better advocate for you than yourself and your physician. So that's a great value. Okay, are you ready to go to the next question? No, we've got one back here.
I value the ability to be able to have disability insurance from my government through Medicare, even though I did not have any health care when I needed it.
Okay, you value your Medicare and your insurance. That's as we've talked to people across the state, many Medicare beneficiaries really like their Medicare. Okay, well, let's move on then to the second question, and we'll try to allot about 10 minutes for this. And the second question we're going to ask you is, if there is one thing you could change about today's healthcare system, what would it be? The single thing, if you had the divine right here to change one thing, what would that be to make this system better?
What I wanted to say was this: I have taken and worked in home health, nursing homes, and hospitals for most of my working career. And the one thing that I hear consistently from my patients is, why doesn't the doctor listen to me? Yes. Why do they not listen? With all due respect, y'all don't listen. At least have the courtesy to respect people and their feelings.
Communication is very important, and we understand that, and that's something that we'll certainly take into advisement. Back here.
Remove or reduce the donut hole.
Amen.
All right. Don't feel like we need any more government help, huh?
Access to health care for everyone who needs it. I was in a position to know a lot of people who lose their jobs, maybe at about age 50, don't have any insurance, can't get coverage. I think they should be able to get it.
Access to care. We agree with you totally that we need access for all Americans. We have one here and then one here.
I don't like this system we have of day surgeries and then go home. Some people are just simply not ready to go home that evening or even the next morning. And we just had a case like that in my family in August, where my daughter-in-law had a major hysterectomy from cancer. They finished her up at 4:30 one day and released her at 9 a.m. the next morning. She was back at the emergency room every day for the following 3 days with fever and urinary problems. And I don't think that we have a very good system on the day surgery.
Okay, so again, it's access and home care and follow-up.
Portability and pre-existing conditions.
Portability, you want to see portability in insurance. You want to see pre-existing conditions eliminated as a prerequisite for insurance. Well, you're not by yourself. A lot of people in this country think the same thing.
What I would like to see happen for changes is to open up the borders to competition for insurance companies. When you're stuck in your state and you're only allowed certain companies that you can choose from, like some states are totally Blue Cross Blue Shield, they have no other choice. I believe it was Alabama they were using as an example. Secondly, is tort reform. Tort reform needs to be done because of the waste. In 2003, it was over $240 billion paid to injury lawyers and all their malpractice suits and all of this. In 2007, it was $845 billion. So we need tort reform. And Howard Dean of the DNC says we will never have it.
Okay, so tort reform and interstate insurance purchase, more competition, bring the price of premiums down, that's what you'd like to change. But you're not by yourself. A lot of people agree with both of your points. Dan, right here in front of you.
I'd like to change about prescription drug plans, where we're able to get our drugs cheaper. I'm fortunate where I have a mail-order drug pharmacy, and I can afford to get my drugs cheaper. But a lot of my friends are going through Canada, and there is a big, big difference between our prices and Canada's prices. And I think that is something that needs to be looked at.
Okay, high cost of drugs is what you'd like to change.
I would like to see insurance companies not able to turn you down because you're on certain medications, which is what I've been told. I take a steroid for a problem that I have, and it's not like it's something that's my fault.
Falls kind of under the category of the person over here with pre-existing conditions. You'd like to see that eliminated, so no matter what medicine you're on, you can still get insurance. Very good, right here.
I think it'd be helpful for the general public to understand a little bit more in depth what some of these suggestions, what the ramifications are of some of these suggestions. Tort reform, which we did realize here in Texas, did not bring the cost of insurance down. And in fact, I think the medical malpractice is still at about 14 to 16% for the doctors. As I understand it, Arkansas, I think, is the state with Blue Cross, and their margin of profit, because they are a nonprofit, is 0.06%. It's very different from regular insurance companies. I think there's also reasons why our cost of drugs are higher than Canada, and I think it would be helpful for people to get together with experts that have statistics about these items so that each of us can understand what the greater complications are. We've been waiting for our legislators to do something about Medicare going bankrupt. There's a reason they haven't. They want to get reelected. It's a hot potato. We're not going to like what the decisions are, but until we understand more completely what the consequences are of making certain changes and what better solutions would actually be, only then can we decide what direction we all need to go in.
Right, so decide what the consequences are of some of these health reform changes.
No, I'd like the citizens to have a better understanding of specifics of all of the details in healthcare delivery. I personally would also like to see our legislators have the same kind of health coverage and health benefits that we do. If they're going to vote on any benefits for us, let's have that get the same health.
Well, just as a point of clarification, since 2003, and we've got tort reform in Texas, it has been more successful than our wildest imagination. And it was never about the premiums. Tort reform was never about premiums, changing premiums, either for insurance or for doctors. The real issue in 2003 was that we were losing access to care for our patients because none of the doctors could afford the insurance that was required for professional liability. We had virtually no family doctors able to deliver babies in rural areas. If you drew a line from Beaumont to San Antonio to El Paso, south of that line there were no neurosurgeons to see patients with head trauma. All of that has turned around. Premiums are down 40 to 50% for doctors, and we have gotten, we now have about 4,000 new doctors coming to Texas each year. And more importantly, we have a number of specialists and subspecialists that had left Texas that have come back and have brought new specialists and subspecialists. So tort reform was really not about premiums, but about access to care for our patients. So that's a good point. We need to know and understand.
Well, it's that kind of clarification that makes it understandable for the rest of us.
Right.
That was very helpful, and that's exactly what my point was. We'd like to get more information on our.
All right, let's take just a minute or two more on this question, and back here and then down here.
We have doctors to diagnose, and we have them writing out prescriptions. One thing that I have a problem with is basically the insurance is coming back and saying, hey, we're not going to cover that anymore when they already have. And then you have to get a generic. There's no generic. Therefore, you go to the doctor, which I have a fine doctor, that had to change the medication to something that they would be paying for. Well, let's put it in the doctor's hand, not the insurance companies, to tell us what we're supposed to take as medication.
Okay, so insurance reform would be something that you'd want to change if we could, huh? Right down here, Dan.
Yeah, I guess this goes along with
this goes along with tort reform, but fundamentally, from a market standpoint, the insurance companies are middlemen. I'm only 62 years old, but when I was a kid growing up on a farm in Tennessee, we didn't have insurance companies. So I guess what I'm saying is to go along with tort reform, I'd do away with the insurance companies.
Okay, so if you had the divine rod, you'd say no insurance companies. Well, certainly in the debate, insurance reform is part of it, and yes, we need to direct more of the dollars to direct patient care than we do to administrative functions and profits for insurance companies.
What do you want, Jay?
I will take a little different view. It is the patient's responsibility to take care of themselves. They need to learn how to take care of themselves when they're young, and take care all the way through. How many people do we have getting intoxicated and driving into a tree and so forth? No medical experience can take care of a person of that action.
So self-responsibility certainly has a place in here, is that right? Okay, back here in the back. We'll take this last question, and then Mr. Finch is going to give us a little overview. All right, back here while we're waiting.
No, actually, mine kind of builds on what this gentleman just said. How could we find ways to reward individuals for doing healthy things like quitting smoking, exercising 3-4 times a week, things like that? Ways to reward instead of focusing just on, when somebody comes in and they're ill, of course you're going to treat the patient. But if you keep that person healthy over many years, it's less likely that individual is going to get sick.
Okay, so we need to define ways to incentivize people to take better care of themselves, and as they get older, incentives certainly do work.
If I had the divine rod to change something, it would be the overall quality of health here in the United States. There's this pervasive rumor that I've heard at several of these, or a couple of these town hall meetings, where somebody always gets up and says, we have the best healthcare system in the world. In actuality, that's just not true. In a UN report 2008, the United States ranked dead last among developed countries. And the debate is, what do you call a developed country? According to the World Health Organization in 2000, the U.S. ranked 37th in overall performance
and 72nd in the overall level of health. And if you look at the G8 countries that's in that group, the United States ranks 5th, which is actually behind Canada, with the leader being Australia.
Okay, so certainly quality is something that we're all concerned about, and quality is certainly at the forefront of all of the initiatives that are being proposed. I would say the only problem is that when you look at the World Health Organization and those and start trying to compare statistics, you're not comparing apples to apples, even oranges to oranges. All statistics are not exactly the same, but we certainly understand your point, and quality is very important to all of us, I think. Okay, last question, and then we're going to have Mr. Finch tell us.
Well, in light of the figures the gentleman just quoted, would it be possible for us to change the borders so that the Canadian patients can't come over here and get health care?
Well, that's a good point. That's why I said it's not comparing apples to apples. That's why most people who want excellent, top-notch health care fly across these countries to come to the United States. Okay, one more, and then we'll have Mr. Finch.
I've got a brother-in-law who lives in Canada, and he wouldn't go to the hospital up there to save his life.
Okay, well, y'all have done extremely well on these very first two questions. Some of our meetings haven't been nearly as disciplined, and y'all have done a great job. So I'm going to turn it over to Mr. Finch now to give us a overall picture of the legislative process and where we are and where he thinks we're going.
Thank you, Dr. Allen. And I hear that we're actually building the border fence on the Red River now to keep the folks from Oklahoma out of Texas. Perhaps that's not correct. I just heard that nonsense. I want to thank you all for being here. What we do is advocate. The Texas Medical Association is a membership organization of 43,000 physicians in the state of Texas. And we are intimately involved in healthcare policy. And we advocate for good healthcare policy on behalf of our members and on behalf of their patients, which ultimately is all of us. And so, I don't want to talk necessarily about the bills. Maybe we have time at the end of the program. We can talk about some of the actual provisions in there. But I do want to talk to you a little bit about process. Because right now there are no less than 7 major health reform proposals in the United States Congress. But you know and I know that there's only one bill that's really getting a lot of attention right now, and that is H.R. 3200. And that bill exists in 3 different forms as it has gone through the process. It has changed from the moment it was originally introduced. It changed throughout the month of August when Congress was not even in Washington. This may, in fact, this is just a parenthetical observation, this may, in fact, be the first time that most congressmen have actually looked forward to getting back to Washington at the end of an August recess. Nevertheless, that bill exists now in 3 different versions in the House of Representatives because it has gone through 3 different committees of jurisdiction. Ways and Means on tax issues, Education and Labor on other issues, but the primary committee in the House of Representatives that is working on that bill is the Energy and Commerce Committee. And that's chaired by Henry Waxman in California. There are several Texas members on that committee. Democrats like Charlie Gonzalez and Gene Green, Charlie Gonzalez from San Antonio and Gene Green in Houston. Joe Barton of Venice is a member of that committee and the ranking Republican member. So we do have input into the committee and the committee deliberations as the bill moves forward. They still have at least 50 amendments to consider to that bill before it's brought to a House floor vote. And it will be brought to a House floor vote when the leadership of the House, the Speaker, and the committee leaders get together and hammer out the single version that they will present for a floor vote. Having said that, we still have the other chamber, the Senate, which has yet to act as a body. The Senate has one bill already, and it's the Kennedy bill that's gone through Health, Education, Labor, and Pensions Committee, but the main bill in the Senate is now being written by the Senate Finance Committee. And perhaps you've watched in the news over the last couple of weeks, or at least over the last week, Chairman Senator Max Baucus of Montana is just now putting putting the language together for a specific piece of legislation. It will be significantly different from the bill that the House is considering. It will, for example, not include a public option plan or a startup by the government. It will include state-run insurance purchasing costs. And there will be many differences in the legislation. The important point is, and this takes you all the way back to civics class in high school, and that is before a bill becomes law, it has to pass both chambers in the same form and be presented to the president for his signature. And ultimately what's going to happen, and this is an issue that is, that you may have thought was going to be settled in July or in August, but it is not going to be settled today, tomorrow, next week, or even next month. This is likely going to be a process that is going to consume the greater part of the fall and probably into December before there is some closure on it. And in the end, we'll have a different Senate bill, a bill different from the version of health reform that passes in the House, that will go to a conference committee, which will include members of the Senate, members of the House, and hopefully they will be locked in a airless, lightless room. I'm just making sure you say that. Maybe we throw the key away, I don't know. But they will hammer out a final bill to present back to each of the chambers, and then for vote and passage onward. Your input into this is extraordinarily important, and certainly for your congressman and other congressmen from Texas to hear the views of the citizens of the state. It's very important for us to hear what you have to say, because you are all patients. We are all patients. Even the doctors among us are patients. And so everybody has a vested interest in doing the right thing. There are many good things. There are many things that are good about our system, but there are certainly things that need attention and need fixing. And that's what this debate is all about right now. What is it that we're going to fix, and what is it that we're going to end up? I don't think there's anybody that can predict at this moment what this legislation is going to look like at the end of the day, other than I think it's the consensus is that there will be a bill, but the question is what will be in that bill. And so it's up to you, it's up to us, it's up to everybody to make sure that the solution that we come up with is ultimately one that improves access, that improves efficiency, and that improves transparency and disclosure and improves the ability for small businesses and for individuals to purchase a real insurance plan that has value.
All right, thank you, Mr. Finch. That's a great overview of the legislative process and what we're looking for. All right, we're going to go to the most important question. We've left a little more time for this, and I'm going to change the way we do this a little bit. We're going to do the next question and get that done, and then we're going to let Dr. Duell make his comments, and then we'll wind up with the final question and answers before we finish. So here is the third question, and as Mr. Finch said, we're probably starting the second half of the ball game. We've still got a long ways to go, so there's still plenty of time for you to tell us what your questions and concerns are about healthcare reform, so that we may be your advocates to try and get what you, the citizens and our patients of Texas, want. So that's why it's important to hear from you, so that we still have time to get your concerns addressed if at all possible. So here's the third question. What do you want or not want from health system reform? What is it you've already answered part of it. You've talked to us about choice, access, insurance reform, those things. Tell us what else it is that you want or you don't want in healthcare reform.
I don't want the government to tell me what doctor I can go see, what hospital I can use, or what insurance company I have to have. I want to have the choice as a United States citizen, and all health care should be available to United States citizens, people in America. And I have a copy of the bill, minus 100 pages. and it was July 14th, and I made it to 55. And I don't know how anyone can understand what is in there right now.
All right, well, choice certainly seems to be very important on people's minds.
I'd like for us not to have any more government involvement than what we presently have. They've not done the best job in the world with Medicare, and I tend to think they're not going to do the best job in the world handling a health care plan for the rest of us. I also do not appreciate the fact that they do not have the same health care plan that we have. They're up there deciding what we need, and they're sitting there royally on their health plan.
Okay, you don't want more government. The government already pays for 47%, over 47% of the health care in this country. They already have 5 government plans that pay, and they're all insolvent. So you don't think adding another one's going to do much good. Okay, back here.
Don't want health care reform that will cover illegal residents using our tax dollars. I understand in the Texas legislature that when they passed the CHIPS bill that the House had a provision that would exclude and make verification that any of the insurance was going to legal residents, but the Senate didn't put that part in their portion of the bill and kind of squashed that. But I don't want something like that in a federal bill.
Okay, so you don't want illegal or undocumented people have their care paid for by your tax dollars. Is that basically it? Okay, well we've heard that, and that's a fair question. Here's the only dilemma we have is that the federal government passed a bill called EMTALA, which means that anybody who walks into the emergency room has to be seen. You can't ask them whether they're citizens or non-citizens. The other problem is that physicians have a contract with society to take care of the sick and the injured. So if a child comes into the emergency room with a temperature of 106 and having seizures, the physician is going to take care of them. Whether they're legal or illegal, you're not going to ask them, you're going to take care of the child or take care of that person. So maybe if the government would enforce our borders and we had some kind of process where we could take care of this in different ways than tax money, then that might be an option. But for physicians, we don't have an option.
Can I amend that then to say insurance?
Insurance, okay, there you go, that's good. All right.
I'm concerned as more people are covered by whatever system that they put into effect, that people like my husband and I, we're both retired military. My husband is already Medicare entitled, and a lot of other people in the room are probably Medicare entitled. Will they be cutting their benefits to cover other people's benefits? That's what I'm really concerned about. People have earned their benefits. So I'm concerned, are our benefits going to stay the same? Where is the money coming from to cover all the rest of these people?
Good question, because the solvency of the federal government and the current programs they have is in question. So that's certainly a very legitimate concern. And then, then we'll come back over here on this side.
Okay, my question is about abortion. We get information from all kinds of sources, some good, some bad. As a Christian, I'm very strong against abortion. I understand Republicans have tried 3 times to get an amendment put in to prohibit any of the money being spent for abortion. Democrats have kept it from happening all 3 times. And I know if it isn't addressed specifically, some good federal judge will say, well, it didn't say it can't be done, so it will be done. So I feel very strong against child sacrifice, if you might say it that way. And It needs to be addressed specifically to not be allowed.
Okay, a lot of people have feelings along those lines.
Is it gonna do any good?
I appreciate you guys very much for coming here today, but my point is on CHIPS, on Medicaid, on Medicare, Blue Cross Blue Shield, any insurance that exists, whether government or private. Many people have talked about the choice of doctors, choice of coverage, choice of a lot of things. My point would be, on the other side, is the choice of whether or not to have it. Because it's altogether one thing to say that we can have a government-sponsored program that provides access. It's altogether a different thing to say that you have to participate in that government-sponsored program in any respect. I guess if you're a business owner, and of course we're unsure of the details now, I understand that. But saying that you have to participate in that if you fall into certain categories, I think would be altogether different and takes the choice away from me. And so that would be the one thing I would ask that you would consider that.
Okay, it's a good point. Choice, again, is very important, and there are surveys in your seats which address some of those specific questions. So be sure and fill out those surveys that we left in your chair so that we can correlate all that information. And you're right on target. That's why we said we think it's important for people to be able to contract outside of whatever plan there is. So be sure and fill your surveys out right over here.
I'm not sure if this is the time to say this, but I am one of the millions of people that does not have insurance, cannot afford it. My husband is on Social Security disability. We're both living on that. And just this past week, I seen on TV and read in the newspaper, they're talking about requiring everyone to have insurance, just like your automobile insurance, or you will have to pay a fine. Well, if you can't afford the insurance, you can't afford the fine.
That's an excellent point, and one of the survey questions specifically asks you about that, so be sure and fill that out. We have looked at this for a long time, and we think that rather than some kind of mandate, that it might be better if we had a system developed where we could individually select, purchase, and own our own insurance, and help those who can't at the lowest end, and in between help transition people, and the people at the high end that can afford their health insurance, let them buy it. So we think that maybe some kind of system where you can individually select, purchase, and own your own policy would be a good answer to that problem. So be sure and fill out your survey.
That is one of the things that I wanted to address. I was forced to go to Medicare when I turned 65, even though I had had insurance from the state of Texas up until that point. They would not let me keep my insurance. I object to that.
You're not the first person we've heard say that, but unfortunately employers, particularly the state and others, once you reach Medicare age, they want to unload the health insurance cost onto the government.
And that's wrong, because I didn't pay into Social Security all that time. So I'm on a free ride. That's wrong.
Very good. Over here?
Yeah, I'd just like to make a comment. Since Obama's appointing all these czars, and the last one just got kicked out because he was a communist, radical communist, will he appoint a czar to run this health care?
Okay, well, certainly there's enough source. All right, let's stay focused on what you want and you do not want from health care reform, health system reform. Right back here.
I have one. I think that we should be entitled to have the health insurance, but it shouldn't be tied to your job. So that when you lose your job, you don't have your health insurance. I don't think that's right. I think I'm young and I got a long way to go, and I know there's not gonna be, from what they say, Medicare and that for me, but yet I'm paying into it, but yet if I lose my job, I'm gonna lose my insurance. So I think we should have a choice, the ones that are working, to have the insurance and it not actually be tied to your job, so that if you do lose your job, you still have the insurance and you're still gonna pay for it. But as of now, if I lose my job tomorrow, I won't have insurance. So I think there should be somewhere where the insurance is not tied into actual your job.
Right, so if we de-link insurance from employment and it's individually selected, purchased and owned, and you get assistance to buy it, that might be a good option, so that it would belong to you. If you change jobs, it's still your insurance and it travels with you. That's good. A lot of people think the same way. Back here?
To expand on the lady who addressed she was forced to do Medicare, there are individuals who are wealthy enough to afford the insurance that are still, the Medicare first and then their insurance kicks in. To me, that's backwards. If they can, if they're wealthy enough and they can afford the insurance should kick in first, should pay first.
Okay, that's another thought. Most people do take out Medigap policies or Medicare Advantage policies to supplement Medicare, because if you really get sick, Medicare only pays about 50% of your cost.
I want to get my 2 cents worth in on this.
Okay.
Take a dime. Okay.
That's good.
When people working in the private sector, you pay for your insurance. Why don't we start with those turkeys up in Washington, D.C. and let them pay for their own insurance? Everything, you talk about welfare fraud, everything is a freebie for the congressmen and senators and all of them. Let them furnish their own, they can, if they'd pay their taxes,
Certainly some people have certainly mentioned that they ought to be on the same system we are, but
They should.
When we let Senator Dole might want to answer that question. Nino Federale.
Just a reminder, he is a state senator.
Okay, over here. Y'all are really a great crowd, let me tell you.
I have 2 comments that I wanted to make. I know in some states, at least one, and I don't know whether it's Michigan or Minnesota, they are going with co-ops, and they seem to be working very well. Have they thought about anything about that with the federal government having a co-op as an option? And the other question I have, you hear everybody say that, well, if we don't get the insurance to everyone, or if everyone gets insurance, how are we going to have the doctors to take care of them? Don't we take care of them now when they're not insured and we're paying for them? There are a lot of people that don't have insurance and they are not turned away when they need care.
You brought up some very good questions. Yes, co-ops are being considered. Senator Conrad's already introduced a bill or an amendment to a bill for that. And you're exactly right about access and physicians. We already have an acute shortage of physicians, not just primary care physicians, but many specialty physicians. And if you put the 45 million or whatever number it is you want to plug into the system, it may make access even worse because we don't have enough doctors to go around. And so that is a good question and good consideration.
I would like to see whatever healthcare bill comes out, I would like to see insurance pay more upfront for preventative care. I firmly believe that with regular checkups and preventative care, a lot of healthcare costs will go down because we will be avoiding a lot of illnesses. I know I just got a bill almost $2,000 for colonoscopy, and the insurance company didn't bother to tell me that if I had chosen a doctor, in their plan, of course, that did the procedure in his office instead of in the hospital, that they would have paid for the entire procedure, but now I'm paying the excess of the hospital bill because they just didn't bother to mention that, and that to me is part of preventative care. Mammograms, you know, if you have insurance, ladies should be able to go get, you know, mammograms. You know, they should get whatever it is a person needs, you know, to keep them healthy, as opposed to trying to diagnose and treat things later on that could have been caught and prevented.
Well, you're exactly right. I think the Texas Medical Association, American Medical Association, all the bills are addressing preventive care. We know that if you can treat it up front and prevent the long-term side effects, you can save everybody. But most importantly, you can improve the health of your patient.
In answer to the lady somewhere over there just a few minutes ago, she was saying, aren't the doctors treating patients that don't have insurance? Yeah, if you go to the emergency room, they cannot turn you away. Doctors' offices, you better have the money.
Right, and that's one of the things that part of this insurance reform and reform is all about. And you haven't said anything today.
I've been sitting here thinking about it.
All right, well, let us have it.
I lived in Jackson, Mississippi for about 10 or 12 years. I had a pericardial surgery while I was there. My doctor explained to me, or he thought he had explained to me how he was going to do my surgery. And he told me, he said, I'm just going to have to cut you about this much. I said, well, you can do that in your office then, can't you? And he said, oh, no, ma'am. He said, I can't do that in the office. But he didn't explain to me why he couldn't do it in the office. So I sent my husband on to work. I didn't call any of my children. I didn't call any of my friends and let them know that I was going to the hospital. I went in the hospital and I was on the surgery table. They started swabbing my stomach. And I said, wait a minute. I said, y'all supposed to be just cutting me this much? And they said, that's after we get in there. I said, oh. Well, I said, it's just between me and the Lord then. And then after I had my surgery, they put me in the ICU room. And I was very sick. And my husband didn't know where I was at. He looked all over the hospital for me. And then they put me downstairs after I got well enough to go downstairs. And after I got down there was no nurses to come to see about me. And I had to go to the bathroom real bad. And I had 2 IVs, one on one side, one on the other. And I had to take those IVs and pull them around the bed so I could go to the bathroom by myself after I had this surgery. And I had no nurses come to see about me at all. I had to call one of my friends to come up there and have the nurses come down there and see about me. And another thing I wanted to talk about is cleanliness in the hospitals. I had another surgery in Paris, and the nurses come in, they give me a shot, and they throw the needles over on the cabinet, the dirty clothes over on the cabinet, and walk out.
Okay, so communication is very important to you. You want them to tell you what's going on, is that right?
I want them to start cleaning things up and telling me what they're going to do to me before they do it.
We certainly agree with that. Okay, we're going to take a few more questions and then we're going to let Dr. Duell
this is maybe redundant, but I just want to repeat it. My husband and I have excellent health care insurance thanks to a good union we serve. And we don't want the government telling us anything different than what our insurance company's doing.
Right, you want to be able to keep your insurance, your doctor, and your hospital, and your choice.
That's right, we want them to stay out of it.
That's great. Dan?
Life is not fair, but I don't find any fairness in the fact that someone who is not a United States citizen who wants to come over here and get a free ride, education and medical care and whatever, food through the food stamp program and so forth, where my own daughter, who is a U.S. citizen, who's been born here, lived here all of her life, and she can't even afford to get health insurance when she needs it because it's too high.
She paid taxes.
Yes, and she's paid taxes, and just because she's not employed by a large employer who takes care of part of it or is in a large group where the cost would be distributed through a whole lot of people, and the cost would be individually then spread out over that group of people, thus the cost of it would be down some. And there's just, I don't see the equity in that.
Well, I think everybody pretty much agrees that we need to get access to high-quality, safe, affordable health care, and that's part of what health care reform is about, and I think we're all on the same page with that.
But quit giving care to those who are not even Americans. You know, we don't need to be paying for people who are here. Well, so what? They love to come to America. Wonderful. America loves to have our foreigners from other countries. But my gosh, let them pay. If they want to come and get health care and education, then by golly, let them pay taxes and learn our language and become an American citizen.
Amen. Okay,
I've got a daughter that's a brain tumor survivor, and we take care of her now for about 15 years. So I've had a little bit more experience with some of these direct problems that people have had in medical care. I will say that my wife and I are both healthy. We're both on Medicare. We haven't had any problems, and I haven't had the first problem yet with the insurance companies with my daughter because of the doctor's intervention. We've got fine doctors that know how to play the game. Money is finite. I think everyone knows that, but all of these problems have to be paid for. Fundamentally, there are two overriding issues that bother me the most. One is we have a government that is not doing their job. They are not providing the oversight that is necessary. They're trying to get involved in providing the service that I think is wrong. The insurance companies are pervasive in the way they handle their business. They're making unrealistic profits, and they're making doctors, hospitals, and patients suffer. So if we're going to have a system that works, it has to be made up of all of the constituent parts. It could be public, it could be private. But on the one hand, the government needs to get out of it. They need to manage, they need to be the caretakers for everyone, and then the insurance companies need to be held to task to do what they're supposed to do. If they want to hide behind free market enterprise, which I think is having a very difficult time working in this country because insurance companies, for the most part, are monopolies. They're cartels in any area you want to look. And they get by with doing this, and most of these problems could be resolved if those two entities would do their job and we would marshal the forces and the resources that we have in a priority fashion to handle the major problems we have. And one of them is Medicare and the costs that we're going to be facing in the future.
Okay, well, transparency, accountability, you want those sort of things. Okay, well, we'll wrap this section up because we will leave plenty of time for Dr. Doyle to make whatever comments he would like to make. And okay, and Dr. Seals wants to make a closing comment also before we finish. So, Senator Doyle, if you'd like to come up and make your comments, that would be great.
Thank you. Thank all of you for being here. I'm sitting like in a committee meeting, taking notes, and it's always good to hear from constituents as what you're thinking. Again, I will say, Vino Federale. I'm from the state. Not that we're perfect, but thanks to my friends from TMA, I can tell you I've been in the legislature now since 2003, and no one advocates for patients, not for doctors. Doctors want to provide health care, but no one, when TMA is there, they're advocating for patients, they're advocating for you. And I'm not just saying that because we're friends and I'm a member. It's just the facts. Good to see a lot of other elected officials here. My friend Dan Flynn is here, and I don't know if he's left yet, but he had another meeting tonight. Got lots of thoughts about things. If those of you who don't know me, I am a family physician. Maryland and I have been very blessed to be a part of this community since 1986. As a family physician, I could literally throw a dart on a map and go there and practice, and we chose Greenville and have never had any regrets. I would say, you know, our system is the best. Some person referred to a study, and Dr. Allen mentioned comparing apples with oranges. That study takes into account our trauma. We have more cars, we drive more miles, we participate in a lot of activities where we get hurt. It also takes into consideration crime, and unfortunately we have a lot of crime in this country, and it takes all of that into consideration. But when you take a sick patient and access them to the American health system, the results are second to none. That's just a fact. What we have, though, is an access problem. People sort of look at me strangely sometimes like insurance is not the issue. It is an issue, but it is not the issue. My goal as a Texas state senator is not to insure 24, yes, and it's 24 million Texans. My goal as a physician and as a state senator is to try to get access to health care to 24 million Texans. When I was a young self-employed father in the 70s, my health insurance was insurance. It protected my assets. It did not provide first dollar coverage. And one of the things that has happened that has skewed the system is that insurance now is sort of similar to if you had car insurance that paid for your tires and your gasoline and your oil changes and your car wash. And that has, in my opinion, has messed up the system. Somebody mentioned about tying insurance to employment. That has messed up the system. That started in World War II when there were wage and price controls, and the companies needed workers. Many of our workers were overseas defending and dying for our country, and to entice people to work for the companies that were making not only war implements, but also just the other things that we needed here. They had to increase benefits, and one of those things was health insurance. And then after the war, that became a benefit. Unions, when there were many more people in unions, advocated for that. Nothing wrong with it in asking for that, but it has created a problem when people change jobs or lose their jobs or whatever. They don't have that portability, which was talked about. And I've often thought, we have COBRA, where if you can have keep your insurance for 18 months, the premiums are usually higher. And what I certainly advocated for as a state senator, but to our federal friends, was to perhaps let people keep the employment insurance at the same cost it would be if they still work there. But we'll go on, and that's a battle they're fighting up there. I did have a bill in the Senate to allow Texans to purchase insurance across state lines. It did not pass. I also had a bill to put health insurance companies under the Texas Department of Insurance to make them publish their medical loss ratios. I happen to think health insurance companies are raping the system, and people are happy with that statement. Some people, you can guess who. But if you look at what I've seen as a family physician in 23 years of being in Greenville and out of medical school since '83, what I have seen is more and more people who don't lay a hand on a patient that actually are directly involved with the patient's care getting a piece of the health care pie. And as some gentleman said earlier, there's a finite limit of dollars out there, and I think that one reason that I wanted health insurance companies to publish their medical loss ratios is so employers and individuals could see, now what is a medical loss ratio? And that is the percent of money that is paid in premiums to a health insurance company that actually goes to paying people who, again, lay a hand and take care of a patient, such as Dr. Sills or Dr. Allen or myself, or a hospital or a surgeon. We've got some podiatrists here. Thanks, guys, for being here. Anybody, you know, that takes care of patients. Some medical loss ratios are as low as 38%. That means that out of every dollar that people are paying for premiums, only $38 is actually going to people taking care of patients. I think that's ridiculous. Medicare and Medicaid government programs, their administrative costs are 6 or 7%. Now, they pay 50 cents on the dollar for care, but quite frankly, they are our easiest vendors to deal with in terms of getting paid for what we do. So if I see if that program could be administered that cheaply, I certainly think that we could ask insurance companies to take a little less for what they do. Government care, to give you a little perspective with state government, our $182 billion budget, 1/3 of that is health and human services. 25% of that, $45 billion, is Medicaid, which is high. Now, when I say Medicaid, most people think of young women having babies, perhaps babies they shouldn't have, women, children, and that's most of our patients. I hate the word client, most of our clients. But it's really under 30% of our budget. 2/3 of our Medicaid budget, and this is true for most states, and even more so, 25% is high. In some states it approaches 50%. But 2/3 of our Medicaid dollars goes for blind, aged, and disabled, mostly nursing home patients. So when you talk about cutting Medicaid, we're talking about cutting back services to the blind, aged, and disabled. And if you want to do that, let me know. We have implemented plans to try to give people incentives to provide buy long-term care insurance. But that's a tough issue, and one of the jobs is the person who writes most of the health law for the budget. I serve on the finance committee looking at that, is trying to control Medicaid costs. My wife and I support missionaries in Brazil partially, and their 10-year-old boy broke his leg, and they showed up, they live in the jungle, but they went to the hospital in a city, and that hospital would not see that kid until they had to call us and get us to wire them money to have the boy treated. I don't want to live in a country where we have a 10-year-old boy sitting outside of our hospital crying and in pain, and his parents having to call money. It's a price we pay to be a compassionate nation, and I think we have to deal with that. Military retired medical benefits, I certainly agree with that. Mandatory participation, that's being tried in Massachusetts. You know, I think that's a tough issue. There are co-ops, and you're free to do them. Senator Williams passed a bill that lets businesses co-op some to provide health insurance to their employees. And I know there's a minister in town I know that actually participates in a co-op. And the preventative care issue, I got to tell you, I have dozens, if not hundreds, of patients who have preventative care benefits and they don't use them. Time and time again, they don't come in for your physical, come in for your physical. I certainly think patient responsibility. If you look at a way of cutting costs, I think lifestyle. In England, everybody thinks the English system is so good, or the Canadian system. In England, if you smoke, you don't get medicines for heart disease. And you don't get joint replacements if you're overweight. Okay, so think about that for a little bit. We have set up in Texas and in other states have done it too, but one thing you don't read in the papers is that we have set up many, many more federally qualified health clinics like we have here in Greenville. Those of you who know me better know that I was the medical director for the community clinic from '86 to '90. But those clinics treat working poor, low-income people on a sliding fee scale. That's one way that we provided access that saves you tax dollars with preventative care. Back in the late 80s, when I was here and in the public health service, Medicaid did not pay for prenatal care. As a doctor who was delivering babies, every night that I was on call, I would have a lady walk in without prenatal care. and a lot of times it was a disaster, and we would end up sending the baby to Baylor Neonatal Intensive Care Unit, and we found out that for every $1 we spend in prenatal care, we save $3 or $4 in neonatal intensive care. So a lot of the things that we do to spend money, people, in the long term, it saves money. The CHIP bill, I mentioned that, it did pass the Senate. We needed to do that to get it out. The Senate has a rule that you have to, 21 of 31 senators have to vote on a bill, and we couldn't get it out of the Senate. But we knew when we got to Conference Committee, we were going to take it out and go with the House version, just a little inside the politics. But so many other things here that I talked about: portability, day surgery. I know when I was delivering babies, I always thought, at least let me deliver the placenta before I send them home. But some of that is, again, this gets back to physician choice. I think there was a president of TMA, was it you, Dr. Allen, whose theme for his year was kick the third chair out of the exam room? Was that yours? That was his theme, kick the third chair out of the exam room, which meant government or private insurance or anyone. Tort reform did provide better access. It was an absolute disaster in the southern part of this state. Doctors would not go there. It did cut our malpractice premiums, which has given us and our group more margin to take and provide charity care. On average, I think somebody mentioned that you can't get in to see a doctor without paying. Doctors provide about 13% of their care. I'm not talking about not getting paid, people that won't pay their bills. I'm talking about 13% of their care is actually charity care throughout the nation. So there are a lot of issues, and your questions have been great. Again, our system's the best. I don't have grandchildren yet, but I think about them. I have a son now, Marilyn. I have a son, Brian, who is a physician going into radiology, and so I'm concerned about his future. But when you get right down to it, who is responsible for health care? It is the individual. If you look at the uninsured, 46 million, 14 million are already eligible for government services and just haven't bothered or don't know to apply. 10 million are illegal. 10 million have family incomes of $75,000 a year or more. I see patients time and time again in my practice who haven't, I ask them, they don't have insurance, and I treat them and they pay me. Have you tried? They haven't even tried. So we have about 10 or 12 million people that are truly, that need help in my estimation. And let there be no mistake about it. What you're seeing in Washington is not an interest into providing health care to people who need it. It is an effort to provide nationalized health care service. Henry Hyde, the late great congressman from Illinois, said there is much effort at misinformation when the object is illusion. And I would remind you that Ted Kennedy, who I agreed with virtually nothing in the last year, showed a lot of courage in how he dealt with his disease, but he got everything in the way of health care that Obama had said in this dialogue that he shouldn't have. Remember when he told people, maybe older people should just take a pill and live with the pain? Well, Ted Kennedy didn't that. He had everything, and fine. I think that he should have had as much as he wanted to continue his life, but there's a double standard there. So. But we have to deal with this. We have to go back and make insurance to protect assets again. We have to ask people to be more responsible, to be better citizens in terms of their lifestyles, and address this issue. We have to address the issue of tort reform, which you're not hearing out of Washington, D.C. We have to go back and ask for better accountability from our insurance companies. Again, more patient responsibility. And we have to ask the physicians in this nation to think about what they're doing and make sure that we are being good stewards of the healthcare dollar. We're human. We make mistakes. There is no perfect physician in the world. There's no perfect legislator. There is no perfect patient. But together, I think as human beings, if we get back to basics and ask questions about what is fair and what is a decent thing to do, that we can provide health care to the segment of our population who truly, truly needs it. Thank you.
Thank you, Dr. Jewell. I prefer to still call him doctor, although I know he's your senator, but prefer to call him doctor. Dr. Seals, did you want to make any closing comments?
One or two. I'm not going to go up to the podium, I don't like that. I want to thank everybody that I know here. Sound fine. If anybody can't hear me, put your hand up.
Do you want this?
I'll speak even louder. I wanted to tell everybody how impressed I was at how many people showed up, how many people I know who, thank you, who, sorry. It comes from having teenagers. How many people ask really good questions? I think that, as I said in the beginning, what's going to make this process work right is if we talk to each other. I think that for a while what I'm seeing happening is that I hear comments about docs not taking, insisting on people paying, and there's some villainization of us going on right now. As Bob said, and I know for a fact in both Bob's and my practice, we run in excess of nearly 15% of people who don't pay us. And I know for a fact that neither he nor I have ever turned anybody down, money or not. And in this process, if we don't work together, if we don't talk to each other, and as Dr. Allen said, we both become stewards of our own destiny. As people have said, Bob said very well, I can't tell you the number of people who walk into my office, overweight, smoking, who don't show up for appointments, don't take their medicines, and then expect us to make miracles happen. And then saying it's our fault because we're not working hard enough to take care of them. It's got to go both ways. I think doctors have to be involved in the process. And this is what's so great about us being here tonight, is that the TMA and Bob, and we are incredibly lucky to have Bob in the Senate right now. I think you're the only doctor in the Senate. We've got to do this together. We've got to have everybody talking to us. We've got to have y'all supporting the TMA and what we do. Keep Bob in the Senate. And try to do what we can, as everybody has said, not to let the government dictate to us how we're going to take care of ourselves and each other. So again, I'm really, really proud to be part of the community, really proud that so many people came and asked such really good questions.
Okay, well, on behalf of the Texas Medical Association, we really want to thank you, and we really do appreciate all of your questions, your input, your comments. It's only when we work together that we can accomplish the goals that we set. And as we said, we want access to high-quality, affordable health care for every American. And that's our ultimate goal. But y'all have been a great audience. You really participated. You stayed on point and paid attention. You were very respectful of each other, and we appreciate that. And with that, I'll turn it back over to Jack and let him make the final closing remarks on behalf of Hunt County.
Thank you, Dr. Allen. These will be very, very brief remarks because we've been here a long time and most of you have probably only had a cookie for dinner. Incidentally, there are some cookies left and I don't want to take all of them home, so when you leave here, if you'd like to have another cookie, feel free to do so. First of all, let me ask all of you to show our appreciation to those people who comprised our panel tonight and to the Texas Medical Association.
I've been to countless buffets, and I don't think I've ever been to one that had cookies and tomatoes.
Well, we know that the cookies are not very healthy, but we know that the tomatoes are healthy. So that was kind of a balancing act.
Interesting combination.
In fact, I'm not sure where the tomatoes came from, but I hope they were free because I didn't pay for them. I also would like all of you to offer applause to yourselves for asking really great questions, for being willing to participate in this program tonight. I thank you, while we may have different points of view, I don't think anyone here would argue with the importance of the physician-patient relationship, and I think this has really stimulated some communication in this community, and I hope that dialogue will continue. We're grateful to all of you for coming out in less than ideal weather conditions for this important program, and we hope that you will take from it something of benefit. Just a couple of closing remarks. Hunt Regional Healthcare has a couple of upcoming events that I think you might have an interest in. On Thursday evening, and I believe that's the 17th, and for those of you who are involved in any way with the Greenville Chamber of Commerce or have any other affinities with the hospital, we will be holding a business after hours program in the hospital atrium from 5 to 7 p.m. and we'd love to see you there. On October 3rd, Saturday morning, at really essentially the same location, the atrium at Hunt Regional Medical Center, we will be hosting the second annual program called Coffee Talk. And Coffee Talk is a program that is geared to address women's health issues. We have excellent speakers, an excellent program, a lot of healthcare vendors who will be there, and tickets are available. And if you have an interest in attending that program, you may contact the Office of Development and Communications. The primary number will be 408-1062, and we'll be sure that you have a reservation. Finally, when you leave the auditorium tonight, pick up a position paper. For those who have an interest, Congressman Hall, who had hoped to be with us tonight, was unable to be here. And he did furnish us with a 2-page position paper on his views on healthcare, national healthcare reform. And there are copies of that at the table as you leave if you'd like to have one to understand your congressman's position. I think that just about wraps it up. Is there anything else, Dr. Allen?
On your way out, there are some brochures back there that cover a lot of what you were asking and talking about, and there are also cards in there to send to your congressman and to the president about any concerns that you have about health care reform. But it's just a little primer to kind of give you an idea of where things are going. So if you're so inclined, pick one up. If not, that's fine too. And once again, y'all have been a great audience, and thank you very much for coming out in this bad weather tonight.
You all have a safe drive home.